Hi, today I'd like to talk about hepatitis E. It's a viral hepatitis that we don't hear very much about and is becoming more and more common in the US. So hepatitis B is an acute viral hepatitis that's very similar to hepatitis A. It comes in 4 different genotypes, with genotype 3 being the type that we have in the US. It is found in undercooked pork and deer. It also is in wild boar. And so it makes sense that farmers, veterinarians, and slaughterhouse workers are going to be most exposed to it. It has been found in shellfish and mussels as well, probably due to contaminated water. And it's also been found in greens and in field-grown strawberries, again, we think because of irrigation water. It has been transferred by transplanted organs and blood products, particularly pooled blood products. Testing for this is a bit of a nightmare. In theory, you should test for IgM to look for acute infection, but the sensitivity and specificity of the test vary wildly. IgG is measured because it goes up as you're clearing the infection, but some people don't make the IgG, and it also can go down with time. If you're looking for infection right now, you can look at RNA in blood and stool. It is found in stool for a long time after the consequences of the infection seem to be getting better, and these assays also have lots of issues. In the immune-competent host, there is a 2 to 8 week incubation period, and then you get flu-like symptoms. It's like any other viral hepatitis. You get elevation of the transaminases, alk-phos and bili. You may get jaundice, pale stool, and in 4 to 6 weeks, you're fine. In the immune-compromised host, 50 to 60% go on to chronic infections. About 30% will resolve if their immune suppression is reduced. The transaminases are not very high. They can be in the 100 to 300 range, but there is very rapid progression to cirrhosis and end-stage liver disease in the liver transplant cohort. This is a schematic that shows that it can be found in water, pigs, blood product, shellfish, fruits and vegetables, and organs and blood products. If you have a solid organ transplant, a little over half will go on to chronic infection, with 10% of those going on to cirrhosis and end-stage liver disease. We do treat it with a prolonged course of ribavirin and probably modulation of the immune modulators. Sirolimus and tacrolimus aren't good choices, but we don't have well-established protocols because this isn't real common. This shows the curves of IgM and clinical symptoms in the immune competent host on the top, and in the bottom, the immune compromised host. You can see that you may get prolonged liver enzyme elevation in the immune compromised host, plus or minus IgG elevation. And the RNA will continue to be positive in the blood and stool. There are extrahepatic manifestations of this virus, including reduced kidney function and cryoglobulinemia. You can get Guillain-Barré, and there are some other neurologic symptoms. In these cases, you usually have positive CSF for the RNA. So in summary, this is a virus that we need to keep on our radar screen. It's not thought of a lot. It certainly is in Ohio, and especially in the immune-compromised hosts, we need to think about looking for it because we can modify the course. Thanks.